Jasmine, I'll just give it a few more minutes to let people trickle in.
Okay, sounds good.
So I guess we can go ahead and get started. I would like to say good morning to everyone on behalf of Director Suggs Evans. We thank you for taking the time to join today's call. As we kind of been saying throughout this series of discussions, we are really focused at DSLBD on efficiency, transparency, and responsiveness. So as of late, we really wanted to convene this call with our partners at the Office of Risk Management and the Office of Contracting and Procurement so that we could meet with our local businesses, particularly our CBEs, to ensure that they are aware of the district's minimum insurance standards. And this is also an opportunity not only to learn about minimum insurance standards, but also to provide your feedback, any challenges you may have faced in the past or are currently facing regarding the district's minimum insurance standards, as well as any concerns you might have. So I just want to really thank Robert from ORM and Deputy Director Giles for being here today to answer your questions. And also, I would just like to reiterate that while there are many topics that we could be discussing, today is about insurance. So out of respect for everyone's time, I would just like to ask any questions or feedback that you do have are particularly related just to this topic for today. So with that said, I will turn it over to Robert Preston at ORM.
Thank you, Bob, and thank you to DSLBD for hosting this series of webinars concerning the insurance standards in contracting with the district government. So thank you for putting all this together. I want to thank our sister agency here, the Office of Contracting Procurement, and our other agencies that are participating in this working group, if you will, to help CBEs respond to contracting better by being able to meet the insurance requirements. So as Bob mentioned, we're going to focus on those minimum insurance standards for today's workshop, and then we will also focus on, in particular, health services, health-related services. So if you're in that industry, that's kind of what we'll focus on today. But if you have other questions for other industries, we can, if there's time, we can tackle those as well. Or you're welcome to join those other webinars that are more directly related to your industry. All right. So for today, our agenda is that we're going to go over some the goals and objectives for this meeting. We have some background points that we want to point out to you, like how do we get here today. Then I'm going to share some of those minimum insurance standards that we have, and then the next steps, and then questions and discussions. So let's go ahead and go to goals and objectives. So as I mentioned earlier, the goal here really is to support CBEs to meet insurance requirements for district government contracts. So that's ultimately what we're trying to do here with this presentation, and then ultimately also overall in contracting. The objectives here, so how we're going to achieve that goal is really to understand, like Bob said, the CBE's challenges and meeting insurance requirements in the district contract. So really want to hear from you today. The presentation's relatively short because we really want to give you an opportunity to bring to our attention some of the challenges that you've had in obtaining the insurance that's required in those contracts. I do want to say that over the past 8 years of doing this, through our workshops with CBEs, etc., we are, we've heard comments throughout the years and we've tried to address them. We do regularly meet with our insurance brokers on a weekly, monthly, quarterly basis to help understand what those challenges are within the insurance industry and with organizations that contract with the district. So this is just another forum for us to also understand what in the past few months, but especially since the pandemic, what you're experiencing and what suggestions you may have that how we can improve to in the insurance part in contracting. Excuse me. We also want to continue to provide education resources to CBEs for insurance, and then promote, as Bob mentioned, transparency and consistency. And one of the ways we're going to do that is by publishing the minimum insurance standards for the various types of contracts. So how do we get here? Just a couple of points that I already mentioned. The district would like to make contracting easier through transparency. And insurance is definitely one of those topics that comes up frequently during the solicitation period and afterwards, where our understanding is that there is insurance is not everybody's favorite topic, and also most people are not experts in insurance, and so trying to find the right resources and the standards that we use in the district can be a little challenging. The district would like to hear about the obstacles. As I mentioned earlier, this is really, I can't reemphasize that point enough. That's really what we're trying to do here today. That you experience for contracting with the district, specifically in the context of insurance. I also want to let everybody know that these standards are not new. For those of you who've been around with me for the past 8+ years, you'll see that these standards are not new. We're just, again, really trying to see how we can help CBEs find the resources they need to meet those insurance standards. And these are minimum standards, so they're subject to change based on the scope of work. And we'll get into that a little bit, particularly in the first set of standards that I'm going to share with you. So when we look at insurance standards, and then ultimately what end up in the requirements and contracts, as I mentioned earlier, we do consult on a regular basis brokers and insurance companies to see what kind of insurance is out there, what is reasonable, how can we help CBE stay in business should their claim arise. So that's really one of our major reasons why we require insurance. We want to make sure that when we contract with CBEs that they stay in business after a claim does occur. As you know, it can be very costly to have a claim. We also have a fiduciary responsibility to protect the taxpayer dollars. So if there's a claim that arises in conjunction with a contract, we want to make sure that we don't use taxpayer dollars to spend on those claims, and rather we have insurance to fall back on. And then we also use insurance to kind of indirectly vet organizations for us. So through the application process, as you're probably very familiar with your insurance brokers, is that there are a lot of questions asked about standards of operations and what protocols you have in place to kind of reduce or mitigate risks that are associated with your operations. And so there's kind of three ways that we look at insurance. So the first one I'm going to tackle here is the is that a question?
That's different.
All right, thank you. Minimum insurance standards for health-related contracts. So in general, these are, for either individuals like psychiatrists or organizations that provide staffing for healthcare or treatment centers, and then those that provide overnight housing. Now, I do want to say that even though this chart is pretty comprehensive, there are certain caveats that I want to kind of start off with and then go back to. So for contracts requiring going to people's homes or housing, as you can see, the umbrella limit there, that's where the umbrella and the excess liability is applicable, as well as and then for minimum limits, they're subject to increase based on number and types of records. So PII information, for example, or PHI. So if you have, if we require you to obtain and retain that kind of information, some of the limits might increase. For contracts requiring vaccines, blood work, bedding, and or other biohazards related tasks, for those, you will be required to have some environmental liability coverage, also sometimes called pollution. And the minimum limits are subject to whether the umbrella or excess coverage is in place or not. So for example, we require a $5 million umbrella, but sometimes over all the liability lines, but some lines, like for example, cyber, that's not possible. So that's why we've increased the cyber liability to 5 rather than requiring that an additional umbrella goes over it. But these are all very technical, and I presume you all have great brokers that can help you go over that. But I just wanted to point those out, that an insurance program can be put together in many different ways. And the recommendation is that if you have questions about that during a specific solicitation, to ask those questions in advance during that solicitation period. Once that's closed, it's going to be difficult for us to have conversations about different types of insurance programs and how they can be set and be applicable to and compliant with the contract. So the basics for all of these types of insurance are commercial general liability, auto if you are driving a vehicle. Now this can also be your personal auto insurance if you don't have a commercial vehicle for your organization. And that's applicable for all these categories. So for individuals, organizations, or housing. For workers' compensation, obviously that applies to organizations that have employees, one or more employees. So employers' liability goes hand in hand with that workers' compensation. The excess and umbrella coverage, as I mentioned earlier, is applicable to those organizations and housing, and those that provide housing, and not for individuals. We do require some crime coverage, particularly if you're going to someone's home, or if they're staying with you or being treated by you. Cyber liability, again, that increases just based on whether you're an individual or whether you are an organization or provide housing. That also could increase depending on again, as I mentioned earlier, the type of records that we require you to maintain and to obtain. Environmental liability, also called pollution, as I mentioned earlier. This is for if you're doing blood work, any biohazards involved in your treatment, then we either ask you to do it or to provide evidence that whoever you hire as a third party has that coverage in place. So if you happen to have service that picks up your biohazards, then, we want to make sure that that service has that coverage in place. Medical professional is pretty straightforward. It's for those of you who are making medical assessments or provide medical treatment, including dispensation of medicines. So that's applicable for those types of contracts. Professional liability is for those who are not medical professionals, but are providing other kinds of assessments. So whether it's psychologists or mental health or social workers, for example, perhaps less with social workers, but more for professionals like psychologists and other licensed professionals that are not medically licensed. Sexual abuse molestation, that applies to anywhere where you're treating somebody from the vulnerable population, and that generally includes for us minors, those that are mentally, physically have challenges in those areas, and then the elderly as well. So just to reiterate, these insurance have some caveats to them depending on what the scope is, but we wanted to give you a full picture as to what your requirements could look like in a solicitation, depending on what it is that you're doing. So again, minimal limits are subject to increase, and then certain coverage are required for when you do blood work or have some sort of bedding. So we're talking about feces, etc., related to biohazards, and then minimum limits are subject to whether there's an umbrella or excess coverage in place. I think there's also some people here that do lab testing and chemical analysis related contracts. So for those, the minimum limits are a little different, and just because you're not necessarily having anybody overnight and you're not making necessarily any medical assessments, but the standard 3 are applicable, of course, for commercial, auto, and workers' compensation. We do require an umbrella limit on that, and that's for PII and PHI information. We can discuss, we will look at the scope, if there's, in terms of records that we are requiring you to keep or maintain on that, but the initial review of the scopes is that, you are certainly keeping a lot of information, that health-related information on a patient when you're doing these kinds of things. Cyber is less; it's only $1 million. Environmental is $1 million, and professional liability is $1 million or $2 million, because you are doing lab analysis, chemical analysis. Now, again, the umbrella is high because the other limits underneath are low. But if for some reason, some of the programs, some of the lines, if you will, so some of the insurance like cyber, environmental, professional, if you have higher limits, then the umbrella would also not be as high. This is just a way for us to keep it less expensive. Medical equipment, these are the requirements for that. Again, the first 3 are standard. Well, the first 4, employer's liability, of course, goes with workers' compensation. So generally, I look at that as the 3 primary insurance that's required. And then we have the umbrella, cyber, environmental, and professional liability. So those are kind of the 3 health-related ones I have. There are others that might be related, like ambulatory transportation, or if you're doing other types of work that's ancillary to health, we can certainly go over that. I do want to, if you have a question or a comment or suggestion throughout this process, please go ahead and raise your hand in the chat there, if you know how to use it in Microsoft Teams. If not, we'll open up the for verbal questions in a minute. So these are kind of what we're thinking of the next steps, is basically publish the minimum insurance standards, provide additional continual education about insurance, and establish resources to assist with obtaining insurance. comments that we've had over the past few years, and particularly the past couple of days, is perhaps provide one location for being able to reference insurance when contracting with the district, and a place where there could be like a Q&A section, and then additional resources. So it's certainly something that we're looking at. And then there are other suggestions that were made in the past couple of days and throughout the past couple of years, so we're considering in implementing those. So I'm going to go ahead and open up to question and answers, and then we'll wrap it up with contacts, etc. So does anybody have any suggestions on how we could help improve access to insurance for contracting with the district? Are there any scenarios that you want to provide to us where there's been a challenge that we could look at? I don't. You're also welcome to put it in the chat if you'd like. Yes, Sharon.
Hi, yes, I was on the call yesterday as well, but for the record, I just wanted to say that one of the challenges that I've had is around the umbrella over the sexual abuse and molestation policy, having the umbrella, and that's been the challenge. But you did explain around getting the additional, raising the limits as an option, but that's been the challenge. And also you resolve the cyber piece, so that's where it's very expensive, and I've had most of the challenges on my end.
Yeah, thank you for that. And we did note that yesterday, and we'll take another look at it. Thank you, Sharon. Anyone else? Perhaps the people who've already participated, or those who've already
Yeah, this is Director Suggs Evans. And so I just want to make sure, sorry for joining late, but I just want to make sure our attendees understand this is an opportunity to let us know your thoughts or comments on, are things, are the insurance requirements that were discussed here today. Are you comfortable with those? Are there concerns? And if so, please let us know what those are. This is the time for us, time for you all to give us your thoughts, comments, how things can be made easier. If you have questions regarding certain types of insurance and why you need to have that. And if you don't, that's great too. We'll say we're good with this industry and the requirements that we may be recommending for contracts. But I just want to make sure you use this as an opportunity to let us know how we can do better if you feel we need to, as it relates to that.
Thank you, Director. I know we've done some heavy pushes over the past 7 years with DHS and DBH, and we've had multiple conversations in that arena with folks. So perhaps, and these insurance requirements are pretty much the same as they were back then and throughout the past few years. So hopefully, yeah, Sharon.
Can you explain the auto liability? I have it, but I'm not quite sure I understand, the reasoning for it as a healthcare staffing agency. If you don't have your own, like a corporate vehicle, can you kind of explain what that coverage is for and the requirements for it when employees drive back and forth to work in their own personal vehicle? I use my personal vehicle. How does that requirement apply in the government setting?
Yeah, Sharon, it's a great question. One that comes up frequently. It's basically to require that people who drive cars have auto insurance. And so when the solicitation goes out, we don't really know the types of organizations that respond. And so we are, we have this standard commercial auto insurance language in place. I have instructed our brokers to take another look at how we word that requirement, and perhaps we can add something for those who are using their personal vehicles. But in the time being, it was just because we don't know which organizations reply and what they're going to be doing in terms of transportation to and from the required locations. We just we included. It's basically just make sure you have auto insurance if you have a car. Just like workers' comp, you're required to have workers' compensation coverage when you have employees.
Thank you.
You're welcome. And we will also conduct additional training internally. So hopefully, we'll I mentioned yesterday because it came up, employees change all the time, and we do try to maintain a certain standard of training, but even, contracting officers are not insurance experts. And so, there's some behind the scenes consultation that happens, et cetera. So, don't be disheartened if the initial answer is no. Just, throw out a question out there, and there's processes in place for us to revisit some of those. Those questions should again happen during the solicitation period. Once that's closed, it's going to be very difficult to change anything. So make sure you talk with your brokers in advance. If there is a certain contract that you think you're going to be awarded, but don't have, not sure where the task order is going to be applied right away, or that you're actually going to get business, like the DC supply schedule came up a little bit. My recommendation is that you talk with your broker and get quotes in hand, so you understand what to budget for in your response, rather than wait till after the award and then have a sticker shock, for example, or not be able to obtain a certain coverage. Yes, is it Charlene?
Yeah, thank you. I have a little trouble getting in, so I apologize if my question has already been asked and answered. But I wanted to ask about two coverages.
Yeah.
My agency, JDOT, we are a PSH provider through DHS, and which I understand falls under the housing category because our umbrella liability limit is 10 million aggregate. But I see here the example of housing says treatment centers, and as PSH providers, permanent supportive housing providers, we are not treatment centers, right? We are providing case management to folks who have experienced homelessness. So I guess my first question is I'd like to understand why we fall under the third column here rather than the second column, because we are really an organization, not like providing direct, where nobody's being housed in the buildings that we own or anything like that. And then my second question is just if you can explain the reasoning behind the cyber liability being 5 million. I know that resulted in a really significant premium increase for our agency, and we're a small agency, and that has really been a burden. So again, sorry if those have been asked and answered, but wanted to ask about those two specifically. Thank you.
Yeah, no, those are great questions, and they haven't been asked during the session. So, I mean, housing is overnight housing. So if for some reason, you in your contract, you have $10 million umbrella, maybe there's something in the scope that increased that requirement. If you should be falling under organization, again, those limits are minimums. So they could be increased at any particular time, depending on what's in the scope of work. In terms of the cyber, yes. So, we used to, in about 3 years ago, maybe I'm not getting the dates right, but the insurance companies that used to include cyber under their umbrella no longer do that. So we were counting on that, which is usually less expensive to get than increasing the minimum limits for the insurance. So for cyber insurance. So what we've done is, now that insurance companies no longer allow for umbrella coverages, or don't provide coverage for cyber under umbrella coverages, we've just increased the the primary line, if you will, the primary insurance there, which is cyber, to reflect what we've been requiring. It's just a different way of showing it. And that is dependent on, again, the scope, primarily on type of information that we expect the organization to either hold or to obtain. So that's kind of the driver behind that.
Okay, understood. If I could follow up briefly on the first point on umbrella and liability. So I believe like the scope for us is the human care agreement, which is the contract that all permanent supportive housing providers have with DHS. I guess my ask is if ORM and DHS, like if there's a space for those two agencies to have that conversation, because when we have asked DHS about this, they have essentially said, these are the requirements from ORM, and we are just following that. So if they're, and I don't know that us as, I know that several providers have raised this with DHS, and that has been the response. So I guess my ask is if ORM and DHS, if there's a space for those two agencies to have that conversation and maybe realize, because I really don't think that there's anything in the scope of the HCA that would put us under housing and not organization. But I think that that's beyond the scope of like an individual provider like us to say, hey, actually, we think that this is wrong. So I just wanted to put that out there and see if you guys can have that conversation.
Yes, sure, of course. We continually have this conversation. So, but I will note that particularly for the umbrella that you mentioned there, just to revisit that scope and make sure that those apply to what it is that, the solicitation that goes out, that they're relevant.
Excellent. Thank you.
You're welcome. These are great questions and great observations that we can follow up on. Anything else? Charlene, you still have your hand up. Is there something else you want to talk about, or is it just? There
was one more, but yeah. I saw that Keisha commented in the chat, and I don't want to cut the line, so I will put my follow-up question in the chat. Okay. Yeah, you're welcome to do that or talk to them now. We might not be able to answer everyone's questions and concerns at this time, but we are taking note of them. Let's see here. Is there consideration of the business size and the minimum requirements between individual organizations? It's more about what we're asking to do in the solicitation than the business size. And because we don't know in advance the business size that's going to respond to solicitation, it's very difficult for us to modify any insurance requirements post solicitation. So basically what we do is we do look at kind of, based on what we're asking and the previous responders, there's a lot of thought process actually goes behind that. And size is one of them, but ultimately it's the risk that's associated with the scope. And we have to think that, large organizations as well as small ones will reply. And ultimately what we want to make sure is that our CBE community stays in business, and should there be a claim. So whatever our broker suggests that an average claim would cost is usually what we go by, more than what an organization is, what size it is. Is there any financial support to small businesses that will have a hard time affording these insurance? So that's a great question, Keisha, and actually that is one of the things that we are looking at. What are some of the possibilities in that area? But I can't guarantee that anything will come to fruition, particularly given the budget being tight as it is. So here. Yeah, I mean, recouping the expenses of a business, I mean, that's kind of that's an internal operational question that you have to decide, as a business. As I mentioned before, having a good broker,
is key, who's able to get access to insurance at the lowest price possible, and also give you advice as to how to put your insurance program together that's the least costly for you. And then also, like, if you don't have the type of insurance that we require on your day-to-day basis for your operations, which we would have expected you to already have, my recommendation is that you at least ask your insurance broker to get some quotes to see if it's even feasible financially for you to then apply for the solicitation, and respond to it. Because once that solicitation is closed and you're awarded the contract, then the expectation is that you do have the insurance in place at this time. Cyber, there's no there's a question here about whether whether there's a rubric I could provide in terms of why the limits are a certain way, particularly for cyber, and there's not. There's a lot of analysis that goes into these limits, so it's not as easy as just providing a points, bullet points on that subject. But we do review again all our limits regularly, and talk with our brokers and with insurance companies to see what a cost of a certain breach would be based on information, data sets, etc., that we ask people to carry. Any other questions? So we're going to note all those in the chat for sure, and then I've written down the ones that were asked verbally, and we'll talk about them internally in our groups, with our agencies. Again, we're working with, and actually, let me put up the contact information. So for specific solicitations, I just want to remind you that you should go to your contracting officer. So go directly to the person who's listed in that solicitation for questions and answers. Again, that's the best time to ask questions, is during the solicitation period. If you have insurance questions, if you've run them by your broker and they have questions in terms of why you're being required this or that, this is the time to ask, so that we have fair and transparent competition. So that way everybody gets to see the question, everybody gets to see the answers, and we're able to modify anything if we need to in terms of the insurance front. For general contracting questions, the Office of Contracting Procurement does have that Procurement Center of Excellence, so feel free to call that number or email them. For general contracting insurance questions, you can contact us at the Office of Risk Management. Again, these are just for general questions regarding contracting. If you have questions about how to get a good insurance broker, or about the types of insurance that's out there, the Department of Insurance, Securities and Banking is also available to answer those questions. They're also working on some additional resources for small businesses in conjunction with this endeavor. Now, the Department of Licensing and Consumer Protection, they also have an insurance section on their website. I just want to point out that that's for licensing. So that's just for doing business in the district. And there's a distinction between obviously contracting with the district government versus just doing business in the district. So those requirements will be different. Yeah, if there are no other questions, I think the chat will be open for a little bit if you want to continue putting your questions in there. Otherwise, you have also DSLBD's contact information, and go from there. Yeah, Sharon.
One last comment. Did I hear that you would be able to provide maybe a list of brokers that you mentioned that you collaborate with brokers? I mean, I do have I believe a great broker in the district who vets, but as someone said, it's expensive, and it's always good to do comparison shopping. It would be nice to be able to have a list of brokers who you could shop around with that's been vetted to know that they can provide the coverage that the district is asking for. I'm not sure if you've considered that, but that would be helpful as well.
Yeah, thank you, Sharon. It's one of the things that the Department of Insurance Banking, Securities and Banking is working on. So we'll definitely let everybody know once all that information's out. All right, if there's nothing else, I don't want to belabor the meeting, hold people longer, but thank you again for joining today. Really appreciate it. Thank you again to DSLBD for hosting and for our sister agencies for joining. And I wish you all good luck with your contracting. Thank you.
Thanks, Robert.
Thanks. Bye.
Thank you.